And with that, I kind of want to bring in Maggie Vespa now to talk to us, because I think we should tell people who they can call instead of just focusing on who is maybe not responding. Right. So, and I want to talk about something that you have covered extensively, which is the houseless community, and something that I think a lot of people in Portland have seen time and time again, which is they are experiencing a person who is going through some type of mental crisis, and they feel helpless as to how to get involved or maybe help that person.
Yeah, we've all been there on Portland streets, right? Like, everybody's been there, to the point that I ask people on Facebook to tell me about a time when they've been there, when they've seen someone on our streets who clearly needs help. And viewers did not hesitate. Julie wrote in, here's a couple of examples. Julie wrote in and said, Memorial Day, there was a woman meandering down the middle of my street wearing a bra and capri yoga pants, twisting her hair and talking to herself. It was hot out and she was walking around with no shoes on the cement. Then she wrote, the police came, they talked to her and left because she denied needing care. Then Jackie wrote in about a different woman and said that the woman was throwing dirt and rocks onto the road, walking out into traffic. She was wearing underwear, a bra, and a clear plastic bag, like a poncho. And then she said, we called non-emergency, but we couldn't get through. We eventually called 911. An officer showed up about 20 minutes later. She flashed them and they left. And, you know, Jackie's point speaks to a big question. And in our newsroom, I've gotten this question from our coworkers. We've talked about this. People want to know, who can you call? Who are the options?
The people in those examples clearly need help, intervention.
Yeah, and is 911 and non-emergency, are those the only options that we have? So for the last couple of weeks, I've been reaching out to city and county officials, to housing advocates, basically people who should know, and there was no consensus. About half of them actually forwarded my email to Portland Street Response. That's the new program that sends an EMT and a crisis counselor to nonviolent mental health calls. But right now, that's only up and running in the Lentz neighborhood in Southeast Portland. So for most Portlanders across the city, they can't call and ask for Portland Street Response. It's not an option right now.
You talked about the officials that you spoke to. I sat down recently with Multnomah County District Attorney Mike Schmidt, and it's coming up on his 1 year, and we kind of wanted to talk to him about what this year has been like. And I asked him what I ask everybody: who would you call in a situation like that? And he really didn't have an answer either. Take a listen. And the average person who I talk to and ask that question to, they don't know the answer as to who to reach out to or who to call in that moment.
That's a great question. I mean, honestly, you know, if it's not a crime happening, you know, I might call non-emergency, right? Because it's maybe not a 911 thing, but hopefully you can get directed to some assistance. I think Multnomah County has other numbers that you can call to get people that I don't even know them off the top of my head.
Me neither. And I mean, is that something we need to do a better job of educating? I couldn't tell you the non-emergency number right now off the top of my head.
I have it saved in my phone, otherwise
right. So
I couldn't tell you either.
So it's pretty wild to think about.
Yeah.
I mean, and again, two people who you would assume would probably be ones who would know those answers, but we didn't. But we looked for them, okay? And we did find out some things for you. So Maggie, why don't you tell us what we've learned?
Yeah, we found one resource that a lot of people don't know about. The staff who work for this service say they know a lot of people don't know about this. So right now, I want you to grab a pen. I want you to grab your phone and get ready to write down this number or put it in as a contact. This is one number, one resource. It's available across Multnomah County 24/7.
Years into a housing crisis, it appears more people than ever are struggling on Portland streets.
You have to give us a place to live.
People who don't appear dangerous. They're not committing a crime. They just need help. Portlanders see it every day.
Like, I was just looking at a guy that was half clothed, and I'm like, dang, who do I call?
For weeks, our team has been asking, are 911 and the police non-emergency line our only options?
Who would you even call? Do you even know who to call?
No.
Too many of us don't know.
And if I was going to say anything for folks, I would say pull out your phones right now and create a new contact.
Enter Julie Dodge and a lesser-known phone number. Here it is.
Plug in the number 503-988-4888. It's really easy.
Again, that's 503-988-4888. That number, which we'll leave up for another 15 seconds, is Multnomah County's official mental health crisis line. It's been around for more than 20 years. Operators answer it 24/7, and they can dispatch services countywide. In fact, they field about 70,000 calls per year.
You can call us when you're having concerns about anyone for anything. You know, whether it's a family member who you're concerned about might be having some mental health concerns, is depressed, maybe you haven't heard from them, to a neighbor that you haven't seen in a while, as well as people that you see outside who you're not sure how to respond to them or how to approach them.
All that begs another question. If you called, who would they send?
My name's Jackie Thompson, and I am a co-program manager at Project Respond.
One prime example, Cascadia Behavioral Healthcare's Project Respond.
We're the people that can go out and kind of be those experts that say what might be going on for that person.
Based out of their discreet Northeast Portland headquarters, Project Respond is also available 24/7. They have as many as 8 teams on staff at all times. Each team is made up of 2 master's-level mental health clinicians who respond to nonviolent mental health calls across Multnomah County. 911 does not dispatch Project Respond. They take calls via the county's crisis line, or they can be paged by first responders on a scene, like police or firefighters. They can do everything from taking someone to a hospital or shelter to pointing them to the nearest food bank.
What we're trying to do is look for the immediate, within the next 12 hours, can someone take care of themselves in like an adequate way, and can someone make sure somebody doesn't hurt themselves or anybody else.
Project Respond has been around for decades. If you've never heard of them, you'd be forgiven. The clinicians dress in street clothes and drive white, unmarked cars. For years, Project Respond wanted to fly under the radar and protect those they helped from the stigma of mental health crises. But now, Portland is in crisis, so they're spreading the word. Call the Multnomah County Crisis Line. Again, that number is 503-988-4888. And know that teams are standing by to help.
We still have this unfortunate worry that when we show up, somebody's going to be worried that their neighbors are going to find out that a mental health response came. But the other side of that is a community saying we want more mental health and it to be really accessible to our community.
All right, here's that crisis line one more time. And something to note, by the way, and this might seem obvious, but just want to say Project Respond and similar programs, they don't have lights and sirens. So response times can fluctuate greatly. They can frankly get stuck in traffic. They won't get there most of the time as fast as police or EMTs would. So if the situation seems urgent, or if you're concerned for your or anyone's safety, everyone we talked to for this piece says absolutely call 911. That's the best choice.
Speaking of 911, I kind of want to circle back to the street response team because, again, this is the team that's supposed to help in this situation. That's only right now a pilot program in one neighborhood of this city.
Yeah, exactly. So for those who have been keeping up, Portland Street Response was supposed to go citywide basically next spring. But sort of earlier this year, the city council kind of pumped the brakes a little bit. And they said, you know, we're going to wait to guarantee that funding. We're going to see how it goes. We're going to review the data. Mayor Ted Wheeler was one of the people who felt that way. So it may go citywide next spring, and it might be a delay because of that by multiple months. So a lot of people were pretty frustrated by that, if you remember.
We are learning some things during this pilot program, though. I spoke to some people from Street Response recently, and one thing that surprised me is that even when they are finding people who need help, they often cannot provide that help for them because right now it doesn't exist. Listen here.
I was out in the field and I was working with someone who wanted shelter and also wanted to get into drug treatment. And we tried contacting our services and our partners that we typically work with, and there was nowhere that we could take this person.
So forgive me if I'm wrong, but wasn't that one of the big selling points of a program like this? Not just to respond and to keep maybe police officers or someone with a gun from being the only point of contact with someone in crisis, but also to find them help.
We knew from the very outset of this program that there was already a gap in the system for all three of those, the housing, the mental health, and substance use. So that's no surprise. What we decided to do with that is to try to collect that data. So now every time that we can't get somebody into a service, we're documenting that into our chart. And our hope is that at the end of the 12-month pilot, we can take that to council and to the county and say, here's where the gaps in the system exist for us.
So they are tracking the number of times that they can't get people help who need help, which I guess can't entirely surprise you.
No, I mean, that's not shocking. At the end of the day, our resources in this community are overwhelmed, and that includes the county's crisis line and Project Respond, who we highlighted. I mean, they've already responded to more than 2,900 calls and made contact with people on those calls, followed up so far this year. And so with that pace, they're well on their way to setting a new annual record for the year of 2021. So there is just a huge need and not enough resources to go around. But we wanted to highlight this one here today.
Maggie, thanks.
Sure.